All right, everyone, I am back, and we're going to be talking about disorders of the sebaceous or the oil glands. So there are several common disorders. Most common ones are comedones, which are the technical term for clogged pore. You may have heard previous chapter, a closed comedone is a whitehead. It may be filled with bacteria, pus, white matter, and sebum. And then an open comedone is when it's oxidized, it turns like a black color. Those are your blackheads. That's dried sebum. It might have some bacteria. And the open comedones are the ones that you can extract during extractions. Now you want to be very careful when doing extractions because some of the tools, if you press hard enough, you can actually injure the client and cause a scar. So that's something to always be careful of. Know that you can remove a comedone if you're trained, but you need to be very sanitary. Another disorder of the sebaceous gland is Milia, and these are benign keratin-filled cysts that appear just under the epidermis and have no visible opening. They resemble small sesame seeds, and they are almost always perfectly round. They're usually associated with newborn babies, but can appear on the skin of people of all ages. They're found around the eyes, cheeks, forehead, and they appear small whitish masses. Depending on the state, they can be treated in the salon or spa. And this is weird because I know in New Jersey, I don't think we can treat Milia. I remember someone was telling me some procedure. It did not sound legal, but they would use like a fine metal tube and like drain it. We cannot use that in Jersey to my knowledge. If I'm wrong, let me know. But I know other states may allow that with additional training. Also know that acne, which is also known as acne vulgaris, is chronic inflammation of the sebaceous gland caused by the bacteria. Propionibacterium acnes, also called P. acnes. Know that you can have a sebaceous cyst, which is a large protruding pocket-like lesion filled with sebum. Yummy, right? Ooh. They're frequently seen on the scalp and on the back, and they should be removed by a surgeon or dermatologist because sebaceous cysts, they're a cyst and they're huge and they're very painful. We can't lance the skin and open that. That's not sanitary in the salon. You might know this term, the untechnical term I should say is bacne. People that have bacne have sebaceous cysts. There's actually home remedies that people can use because I know some people are scared to have a doctor lance it. One of them is actually using cheesecloth and a potato that's grated. I've heard of that working. Another disorder of the oil gland is seborrheic dermatitis, and this is a skin condition caused by an inflammation of the sebaceous gland. It's characterized by redness, dry or oily scaling, crusting, and or itchiness. Usually appears in the eyebrows and beard and in the scalp and hairline, middle of forehead, along the sides of the nose. You can treat it with cortisone creams. It's a medical condition, but it can be helped in the salon with the application of non-fatty skincare products designed for sensitive skin. Very severe cases should be referred to a dermatologist who will often prescribe antifungal medications. And sometimes if someone has an underlying health issue, it can make it more severe, such as diabetes, which is an autoimmune disorder that can actually worsen the condition, where they might need an antifungal cream. Because with diabetes, they can actually have an overgrowth of fungus like candidiasis, and that can be a huge factor in that. Seborrheic dermatitis is also something that infants may suffer from, which is like cradle cap too. It's very similar. Another common one you'll see is rosacea, which is also called acne rosacea. It's a chronic condition. It's usually a flushing and dilation of the blood vessels. You'll also hear the term telangiectasis, which is a dilated surface of blood vessels. And in some cases, you'll see the formation of pustules or papules. It looks very scary. It looks very sore. Certain factors can aggravate the condition, such as exposure to very hot or very cold weather, very strong heat, sunlight, spicy foods, caffeine, alcohol, and stress can also bring out rosacea. Someone with rosacea may be more sensitive to the products you're using. Just like seborrheic dermatitis, you don't want to use strong fatty moisturizers. Try to use a gel-based one that's very light and non-comedogenic. You know that rosacea can be treated and kept under control by using medication prescribed by a dermatologist. They actually make specific skincare for rosacea, so sometimes if you have a line of that in the salon or spa, or if you call your manufacturer, they can point you in the right direction to what you can use in your client. Now, on to some lovely smelling disorders of the sudoriferous, or we call them sweat glands. Anhidrosis is a deficiency in perspiration, often the result of fever or certain skin diseases requires a medical referral. If someone is severely dehydrated, they're not going to sweat enough, and that can be a sign of anhidrosis. I know in infants is very serious, and with infants, I remember my teacher saying that if you pull their skin, if the skin goes up easily, then you want to get them to the hospital because that's a sign they're very dehydrated. When we have a fever, we always want to make sure we're drinking water because that can dehydrate us and then we'll get very sick. And that's not something you want to treat in the salon either. If a client has a fever, do not take them because that can spread a disease in the salon. Bromihydrosis, which is a foul-smelling perspiration usually noticeable in the armpits or on the feet. This is caused by bacteria. Severe cases require medical referral because, we don't want to be insensitive, but sometimes people have a very foul-smelling body odor even though they use all the best products. In this case, if they go to the dermatologist or the doctor can actually prescribe them a certain cream or medication that can regulate the bacteria. As we're doing more research, we're actually looking into bacteria that prevent body odor, good bacteria that suppress the bacteria that produce the body odor. When we actually have body odor on our armpits and feet, what we're smelling is the waste products of bacteria. Certain foods in the diet can also make this worse, such as alcohol, caffeine, and a lot of sugar, even certain types of food like garlic. If someone has eaten a lot of foods that can aggravate this, you might even smell it in them, and that's where it gets really gross. Malaria rubra, also known as prickly heat, that's an acute inflammation of the sweat glands. You get small vesicles and it itches. It almost feels like your skin is prickling underneath. It is not the same as sunburn, but if you've ever have run out in the humid heat for a gym class, you'll probably know that your skin feels like it's going to itch. It looks really bumpy and red, and that's prickly heat rash. Usually clears in a short time without treatment. So on to some inflammations and common infections of the skin. Conjunctivitis, this is known as pink eye. It's a bacterial infection. It's very contagious, and clients who have irritated eyes should be politely rescheduled and referred to a physician. Any products or implements touching the infected eyes must be thrown away because that can spread them in the salon. Dermatitis is a broad term used to describe any inflammation of the skin, such as contact dermatitis, seborrheic dermatitis. There are so many dermatitises. You'll find that a lot of these words become secondhand because the root word is Latin for something that means like skin or hair, and it becomes commonplace after a while. Don't stress about it now, it gets a lot easier later on. Eczema. This is going to be a very uncomfortable and inflammatory condition. It's usually chronic. It's characterized by moderate to severe inflammation, scaling, and sometimes severe itching. There are different types of eczema. The most common type is atopic eczema, which is an inherited genetic disorder. Something usually turns on the environment. All cases of eczema should be referred to a physician for treatment, which is usually a topical cortisone. Eczema is not contagious though. It's more of a nuisance to the client and it looks scary. With very severe cases of eczema, I've seen people that have had it all around their eyes and it looked like they had sunglasses on. It was that red. It was very sore to look at. They had it on their face, their scalp. Eczema is a very painful condition. Stress can also aggravate it too if they have the autoimmune type. Herpes simplex, this is a recurring viral infection that presents as a fever blister or cold sore. You get an eruption of a single vesicle or group of vesicles on a red swollen base. They usually appear on the lips, nostrils, or other part of the face, and the sores can last up to 3 weeks. And your first outbreak of herpes is always the worst. It's the one that's going to be very big, very sore, and then every little flare-up is usually 1 or 2 lesions around here. Herpes is contagious. You can get it from touching someone, or if they give you a kiss in the cheek. Drugs are now available to control the symptoms, but the virus will always remain in the nerve cells hidden. Impetigo, this is going to be a contagious bacterial skin infection characterized by weeping lesions. Impetigo normally occurs on the face, around the chin area, and it's very common in children. In fact, one of the names for impetigo is also known as school sores. Clients with any type of weeping lesion, open facial lesions, should be rescheduled and referred to a physician immediately. Usually impetigo can resolve on its own, but sometimes a physician may prescribe an antibiotic, especially in a high-risk patient. Psoriasis. This is going to be a skin disease characterized by red patches covered with silver white scales, usually found on the scalp, elbows, knees, and chest, or lower back. It's caused by when your skin cells turn over way too fast, they shed too rapidly, and they get buildup, causing a layer of thick scale. It's very painful. Watch some of the videos of when they actually have to descale it, and it looks very sore. Scalp psoriasis is also very common. You can see that in the salon, and they actually have special salons with special stylists that are trained to actually steam the scalp and put a treatment cream. And what they'll do is they'll massage it and it will cleanse the scalp. So what you can do with psoriasis is you can refer them. It requires a medical referral. It is treatable but not curable, and that's why it's a chronic condition. I have to take a phone call. I'll be right back. Hey guys, so I am sorry about that. Phone calls always come at the worst time, especially important ones. So where I was at is that it's important because psoriasis, even though it's a condition that's not contagious, it's something that can be very detrimental to your client. And that's why if you know the appropriate physician, you can recommend them. And I know it seems like I'm repeating myself a lot, but I just want to drive that point home. The reason why it does require the medical referral is, think of it like this. If a client has scalp psoriasis, there's always that risk of causing them to become sensitive to a lot of skincare products, as well as hair color. So let's say your client has a very bad case of scalp psoriasis. It's completely covered on their head. You don't want to be putting this caustic chemical, like or God forbid, a relaxer. If you put a relaxer on someone's scalp psoriasis, that can not only burn the heck out of them, but you can be at risk for a lawsuit or cause them to get a really severe injury that can result in permanent hair loss. When it says that it's treatable but not curable, that means that psoriasis will always be with that person. Psoriasis is also kind of caused by something in the environment that turns the gene on if you're genetically predisposed to it. It's not that understood, but we're making more research on it. Basically, with psoriasis too, certain products may cause it to flare up more, others can make it worse. You want to find products that are tailored for it. And when I mentioned before that some special salons are able to deal with that, scalp psoriasis, there is a really good video. If you type in scalp psoriasis, the show Embarrassing Bodies covered it. And it was really interesting because the stylist was actually the one to really make this younger girl that had it feel a lot better about herself because she was being teased about this. Her scalp psoriasis was so severe, she had scale that was all the way here covering her scalp. It was red and inflamed. So she went to this special stylist and they took a special treatment and they put it through the hair after washing it, and they put a steamer on it. And after they steamed it, the steam went in there, it loosened up all that skin, and the treatment was able to cleanse it. She went through and was able to gently scratch the scalp, and they got all these flakes out. And it was amazing, like how much came out, but also how the hair was so healthy after a few treatments, and then she was left with only a little bit of scale. And I myself behind the chair have seen psoriasis many a times, and I can tell you that sometimes if the person has hard water, the hard water can actually make the psoriasis a lot worse because it layers up there and it cakes on there. And then you also run the risk, like let's say someone has psoriasis about around the crown area, and they also have a lot of mineral buildup because that can aggravate it. If you put hair bleach on that, the bleach can react with the minerals, and then what you get is a violent reaction that can result in injury, a major lawsuit, and you can lose your license. I went to the summit and I've seen photos of what happens with that, and it's not pretty. It's not a pretty sight at all because you have permanent hair loss. So you can have scalp psoriasis as little as this or as big as the entire head where everything is red, inflamed, and itching. You can have it on your face. So you really want to use good skincare products and get a physician's note and refer them to a physician if they have not seen treatment for it. On to the next part of the skin, which is pigment disorders of the skin. So pigment disorders are issues regarding skin pigments. You guys may know the famous case of vitiligo. I know that there's a million rumors about celebrities like Michael Jackson. Did he have vitiligo or not? From what I've heard, no, he actually bleached his skin out, which I was actually surprised to learn that. But there's a lot of myths too about these spots. For the most part, a lot of these skin conditions are permanent. So once you have them, you will have them for life. Some of them, not always, like hyperpigmentation, depending on how bad it is, how severe it is. You can do products that will treat it and products that can potentially fix it. I know that dermatologists can do laser resurfacing, and that may be very helpful. But it's also important to know that pigment disorders could be hereditary, such as inherited through genetics, through genes, or external, so the environment causes it. It's like that whole idea of nature versus nurture, except skincare. Think of it like this. You can be predisposed to being prone to hyperpigment, but if you live in an area with a lot less sunlight and you're being careful to use sunscreen, you may never hyperpigment. However, on the flip side, if you are predisposed to hyperpigment and sunburn, and you're constantly out on the beach burning and burning and burning, 10, 30 years down the road, you're going to be covered with hyperpigmentation or sun bleach spots. So little things like that you have to take in consideration. Prolonged exposure to the sun, the book says, as well as abnormal conditions such as dyschromias, which is it accompanies skin disorders. No, dyschromias, which is known as abnormal colorations, which accompany skin disorders and many systemic disorders. A change in pigmentation can also be observed when certain drugs are being taken internally. The following terms relate to changes in pigmentation of the skin. Know all of these terms because they're very important with classifying and identifying conditions for your clients, like why we're seeing it on the skin. When it talks about medication, especially the hardcore drugs like serious antibiotics, definitely chemotherapy, that can all change the skin and how the skin looks after it. I have known people that have taken chemotherapy and their entire hair changes, the texture, the color when it comes back, and the skin texture and the pigment on the skin will change completely. There's other drugs too that can also cause the skin to darken, to lighten, or to be more prone to sunburn, so make sure you're reading up on any medication that you take yourself or anyone else. And that's why you'll have clients, when they fill out the form and the waiver, they have to write all the medications they're on, because we have a term that's called contraindications. I'm giving you an early term. Contraindication is something you don't want to have. That means that it's going to react with your service. So hyperpigmentation, the book defines that as darker than normal pigment, appearing as dark splotches. On the flip side, like hyper is too much. Remember that abbreviation, hyper too much, hypo not enough. Hypopigmentation is the absence, which is your albinos will have that. It's lack of pigment all over or in certain spots, splotches like vitiligo. Albinism, it's congenital, so you are born with it. It's absence of melanin that in the hair, skin, and eyes. Hair is silky white, the skin is pinkish white and will not tan. And the eyes are pink and the skin is sensitive to light and ages early because of lack of melanin. You don't have the melanin as your protective factor, so you have to be very careful with this condition not to overexpose yourself to the sun because it can be detrimental. Chloasma, which is known as liver spots, it's a condition where you have hyperpigmentation spots that are not elevated. The spots have nothing to do with the liver, like the commonly used term liver spots. They're usually caused by cumulative sun damage, and there's even devices that can scan the skin and you'll actually be able to see we're going to hyperpigment next. It's really, really fascinating. They can be helped by exfoliation treatments or can be treated by a dermatologist. So chemical peels, chemical exfoliants. I know a lot of vitamin C serums and retinols can help with hyperpigmentation. Or if you don't want to do that, you can go to the dermatologist and they can laser them or do a deep peel, which takes everything off. Oh my gosh, I'm going to pronounce this wrong. Lentigines, which is the singular, lentigino, is the technical term for freckles, small yellow colored to brown colored spots on skin exposed to sunlight and air. Leukoderma, it's a skin condition characterized by light abnormal patches. Hypopigmentation, it's caused by a burn or congenital disease that destroys pigment producing cells. Examples are vitiligo and albinism. Certain diseases can also cause that, like I know really rare, but leprosy, if the spots are deep enough, it can take the skin off, or syphilis, if it progresses to the secondary rash, it can actually eat away at the skin. Leishmaniasis, if it eats deep enough, you can actually eat your skin pigmentation. And in addition to this is why you should never attempt to chemically peel your skin at home if you've never done it before. People that use chemical peels that are way stronger than they need to can actually risk causing hyperpigmentation, or on the flip side, hypopigmentation. I've seen a YouTube video where someone took 100% TCA, which is a huge no-no, and she was very dark on the Fitzpatrick scale, and she ended up with a nice permanent pink mark right here because she muted out all of her melanin cells. The next term they use is called nevus, and this is known as the birthmark. So if you have a birthmark, I always like to use anatomy language in my own vocabulary to help me learn it more. I'll point it and I'll say, oh, that's my nevus, or that's my nevus here. Or if I see a friend, I'm like, oh, that nevus is really interesting. And they're like, what the heck is a nevus? So a nevus is a technical term for a birthmark. It could be small or large. Malformation of the skin that is either due to dilated capillaries or abnormal pigmentation. Not dangerous in any way, shape, or form. It's just how you were born. I've known some people that have had them on their scalp. Some people have them on their neck or in just all over. Stain is an abnormal brown-colored or wine-colored skin discoloration with a circular or irregular shape. Its permanent color is due to the presence of darker pigment. Stains can be present at birth, or they can appear during aging, after certain diseases, or after the disappearance of moles, freckles, and liver spots. They don't know the cause of what causes stains, but think of that term when you're having that in your question bank. Think of like a coffee stain as being dark and tan. That's what a stain looks like. There's also port wine stains, which are a little bit redder in color. They may have a slight purplish or brownish look, and there's a whole spectrum of colors that can come, and this is partly due to your natural pigmentation, as well as to how much pigment is being produced or not produced. tan, which actually is a skin disorder. That's a change in pigmentation of the skin caused by exposure to the sun or UV rays. People that do tan beds will know this all too well. It's not recommended. Your skin becomes really leathery and gross, and you kind of look like you're a leather handbag. Vitiligo, that's going to be a hereditary condition that causes splotches on the skin. It may be related to thyroid conditions, and that's why a physician's recommendation is always important to clients. And when you have vitiligo, you must protect those spots because you're not producing pigment. Those spots can burn while your skin around it will be fine. One thing though I never really got to answer is if you have vitiligo, it really depends too on how you would use your chemical peels, if you're using a glycolic peel or a TCA peel, because depending on the percentage, that skin is going to be a little bit more sensitive, and plus you can also risk causing hyperpigmentation. So I always would say err on the side of caution, use a lesser one when you're treating someone with vitiligo. Very important to read the caution thing, because if someone has moles, actually, you know what? I'm going to end this here. It's been about 20 minutes. I'm going to end here, take a 5-minute break, and then I'm going to talk about moles and not the really cool chemistry formula or the animals. Moles that are on the skin that we don't like.